The Health Wagon is a free mobile clinic, and it is our mission to provide compassionate, quality health care to those that are medically underserved. So we have 3 mobile units, and we also have 3 stationary clinics as well. And we go out trying to meet the basic needs of the healthcare needs of the community. And our goal is to make sure that everyone has access to health care. We do free labs, we do physical exams. We treat abundance of chronic diseases such as hypertension, diabetes, coronary artery disease, mental health issues, and things like that.
Let me ask you, as I said, rural hospitals are closing, so you are a backup to these hospitals. What happened when this pandemic started? Were you able to test people? We've talked so much about the availability of tests or lack thereof in major cities. What was the case with the mobile health service you provide?
We have set up mobile testing sites at local churches, and we've had access to testing, but it has taken as much as 22 days to get the results. Actually, one of our nurses was very, very sick, and it took us 22 days to get that result. Now, the time getting the test back has improved, but that's the problem that we've seen with some of the testing as well.
So tell me what happens in a rural community when the hospital closes.
So we've had over 120 hospitals that have closed in the Appalachian region over the past 10 years. And so when a hospital closes, unfortunately, people cannot access, care in a timely manner. You have to often drive 1 to 2 hours to get that care. And you can imagine an emergency situation. You just don't have that luxury to wait, 2 hours for an ambulance. So unfortunately, people, they actually die. And then there's also the fear with the COVID right now, with the COVID virus. People are not going to the hospital because of the fear. They're afraid that they will get the COVID virus, but they're dying. They're dying of heart attacks and strokes and things like that because they are not leaving their home to seek the medical care that they need. So that is the flip side of this COVID that a lot of people are not looking at, is the COVID impacts that as well.
Well, I mean, you are from an area similar to where I'm from in Texas, where a lot of the young people moved out and they moved to other opportunities outside of the community. And the population of people left behind in rural America, often much older. You have a high rate of lung disease in your area specifically. How has that complicated this situation and the response, given this high risk of age and, as I mentioned, the lung disease issue?
Well, we have a 27% more impact of chronic lung conditions, in the area. So, what we have here, it's been a singular economy of black coal. We have the coal miners, and we have those with COPD. Before the pandemic even started, we were on the phone knowing that it was going to possibly hit, to get these patients that have these chronic conditions, to get them 3-month supplies of their medication so we could get them to the pharmacy now. I mean, unfortunately, I have seen people, going into the local Walmart and, they're carrying their oxygen tanks behind them. I mean, it's very, very sad to see that as a healthcare provider. You just, that they're putting themselves at certain risk.
What happens if we see this second wave, this surge that some are predicting? What happens in a place like your town?
Their local hospitals, they only have 4 ventilators. So if we had a surge, I mean, it could decimate this region. And that is the thing that is most scariest to us, because we don't feel that we have hit the surge yet, and very concerned that, that as a lot of rural areas, that we do not have the capacity, to meet the needs of the health care if the COVID was entrenched here.
Knowing what you know as a medical professional and pointing out that you're not prepared for, the region is not prepared for the surge, are people staying in?
Well, they are social distancing. I feel we've tried to very much educate our patients on that. We've tried to be aggressive as possible, and educating them with that. People, they really, our patients are already struggling with, meeting basic necessities, food and water. So it's not always realistic for them to stay in for, to go to the grocery store and get 2 weeks of food. They just don't simply have that luxury because we're in an area where there's a lot of chronic poverty. So that's where you will see them out, and because they're having to make multiple trips to the grocery store. So that's what's scary as well.